Bismillahirrahmanirrahim. This talk is about preterm labor presented by Dr. Ahmed Turafi. By definition, the labor that started prior to completed 37 weeks of gestation in a pregnancy that beyond 24 weeks of gestation نسميها preterm labor. طيب preterm labor may be established preterm labor or threatened preterm labor. In cases of established preterm labor محتاجين regular uterine contractions at least 4 in 20 minutes or 8 in 60 minutes with progressive change in cervical score in form of effacement of 80% or more and cervical dilatation of more than 1 centimeter. Threatened preterm labor, there is uterine contractions in the absence of cervical changes. Preterm labor is the most important single determinant of adverse infant outcome in terms of both survival and quality of life. بتحصل in 30 to 40% of cases as elective delivery due to maternal or fetal complication زي مثلا FGR or severe preeclampsia. وبتحصل in about 60 to 70% spontaneously with or without premature pre-labor rupture of membranes. بصورة عامة the preterm labor or preterm birth complicates 3% of pregnancies before 34 weeks and 7 to 12% before 37 weeks. Preterm labor is the leading cause of prenatal death and disability. Risk of death or CNS disability, it will increase with the decrease in the gestational age. The mortality increases from 2% for infant born at 32 weeks to more than 90% infant born يعني less than 2 or at 23 weeks. طيب بصورة عامة بنسمي البريتيرم ممكن نقسم البريتيرم ل 3 parts. Extremely preterm they'll بيكونوا less than 28 weeks of gestation. Very preterm they'll بيكونوا between 28 to 32 weeks of gestation. And moderate preterm هم بيكونوا ما بين 32 to 37 weeks of gestation. There is also increase in the psychosocial and emotional effect on the family and increased cost for health services. Risk factors أهمها هو the previous history of singleton preterm birth or late miscarriage ودي recurrence rate تبعها is almost 20%. Other causes like cervical incompetence, cervical surgery, bacterial vaginosis, abruptio placentae, polyhydramnios, smoker, bacteriuria, multiple pregnancy, uterine anomalies. In case of preeclampsia and IUGR زي ما اتفقنا ممكن تحصل spontaneous or iatrogenic. Other risk factors like young and older age, low body weight, or persistent vaginal bleeding during early pregnancy, maternal diseases like heart disease, systemic infection, and renal diseases, anemia, loss of sucralose classes, and strength, يعني work stress. This diagram shows those causes for preterm labor syndrome. طيب, how to identify patient at risk? نمسك risk factors. نشوف symptoms in some cases. الكيسز اللي بتجي يعني establish ولا ب preterm labor. في some investigation ممكن نعملها منها cervical length والfetal fibronectin. How to predict to prevent يعني نعمل prediction then to يعني after that to prevent. طيب بعد ما أخذنا الهيستوري وتأكدنا إنه في الهيستوري ده معانا يعني previous history of preterm labor مثلا بنعمل transvaginal ultrasound which can detect the shortening of the cervical length. إذا عملنا يعني اللينكس دي في 16 to 24 weeks مثلا، وجدنا إنه السيرفكس ده is less than 25 ملم، معناتها الذي دي at risk for إنه يحصل لها preterm labor. إذا كان السيرفكس ده less than 15 ملم at or more than 30 weeks برضو she is at risk for preterm labor. طيب في الحالات اللي بتكون asymptomatic woman with a singleton pregnancy، إذا حسينا إنه السيرفكس ده يعني more than 15 ملم long، الريسك بتاع إنها تولد preterm إذا كانت هي 32 weeks is only 4%. إذا كانت أصبحت symptomatic with singleton pregnancy the risk of delivery within 7 days إنها تولد بعد ما خلاص بقت she has symptoms, she has contractions. Okay, the risk of إنها تولد within 7 days is 49% إذا عملنا transvaginal ultrasound وطلع transvaginal ultrasound ده is less than 15 more than 15 ملم. طيب risk of delivery within 7 days the risk is less than 1% if the cervix is more than 15 ملم. يعني الريسك ده بيزداد with the reducing length of the cervix. كل ما cervix كان shorter كل ما الريسك بقى higher. This ultrasound showing the normal length of the cervix. هنا شايفين الcervix يعني 3.6 سنتيمتر، وهنا cervix is 9 سنتيمتر. is very short 9 ملم which is very short cervix. طيب other modality for prediction is the fetal fibronectin. هو أصلا يعني a protein not usually present in cervicovaginal secretion at 22 ل 36 weeks، لكن بيبقى positive إذا حصلناه more than 50 نانوغرام per ml. The modalities for prevention منها cervical cerclage، وعنده أنواع منها transvaginal transabdominal. Sometimes can be done electively in a woman with a previous loss from cervical weakness, or as ultrasound indicated in response to short cervix on transvaginal ultrasound. The last type is the rescue. This is in response to cervical dilatation with intact membranes. Other modality for prevention هو البروجسترون، نستخدمه in high risk women a history of late miscarriage or preterm birth. هو will reduce the recurrence rate will reduce the recurrence rate in about 50% in the low risk women with a short cervix. طيب effect is absent or very limited in twins pregnancy. الفورمولاز المستخدمة pessaries injections creams oral، لكن أكثر شيء مستخدم هو pessaries and creams. طيب كيف نتعامل مع الالتراساوند findings وكده using the يعني cerclage or progesterone. If we have a woman with a history of spontaneous preterm birth or mid-trimesteric loss between 16 and 34 weeks of pregnancy وعملنا لها ultrasound دي كانت يعني carried out between 16 to 24 weeks of pregnancy that reveals cervical length of less than 25 millimeters. هنا ممكن نستخدم لها prophylactic cervical cerclage or progesterone. طيب إذا معنا woman with a previous preterm labor due to pre-labor rupture of membranes or cervical trauma in whom عملنا transvaginal ultrasound at 16 to 24 weeks of pregnancy shows a cervical length of less than 25 millimeters. في الحالة دي we are going to use prophylactic cervical cerclage. طيب any lady with no history of preterm labor or mid-trimesteric loss in whom transvaginal ultrasound between 16 to 24 weeks of pregnancy shows a cervical length of less than 25 millimeter دي اللي بنستخدم لهم just progesterone. She has no risk طيب of preterm labor or mid-trimesteric loss. والultrasound يعني transvaginal ultrasound showed that the cervix is less than 25 millimeters. This is progesterone. Is again, if we have a lady with a previous history of spontaneous preterm birth or mid-trimesteric loss طيب between 16 and 34 weeks of pregnancy. والultrasound showed that this cervix is less than 25 millimeters. بالhistory فقط prophylactic cervical cerclage and or progesterone. لكن إذا معاه history of preterm pre-labor rupture of membranes or cervical trauma والultrasound done between 16 to 24 weeks and shows cervical length of less than 25 millimeters, this is better for cervical cerclage. If she has no history of preterm labor or mid-trimesteric loss والultrasound show that the cervical length is less than 25 millimeters, the management here is progesterone only. Other modalities to prevent preterm labor: selective reduction of triplet or higher order multiple pregnancies to twins, and this will reduce the risk of preterm labor. Slightly increase the risk of preterm labor. من ناحية تانية بصورة عامة هي بتقلل لنا ال risk of preterm labor، لكن the maneuver itself will increase the risk of preterm labor. طيب treatment of bacterial vaginosis in a woman with a previous preterm birth may reduce the incidence of Preterm and low birth weight. A drug of choice هم الكليندامايسين rather than the metronidazole. معروف إنه drug of choice in the treatment of bacterial vaginosis outside pregnancy is metronidazole. During pregnancy, better to use clindamycin. Okay. Here we are going to talk about the diagnosis and management of preterm labor. يعني established preterm labor. خلاص هي ابتدت حصلت يعني. طيب. Number 1 is the diagnosis. diagnosis بناخده من ال clinical history. clinical history مفروض نحصل منه شنو يا جماعة؟ نحصل منه uterine contractions or نحصل منه rupture of membranes. Other thing is examination using speculum examination. طيب ممكن نستخدم يعني ال CTG to show the regular uterine contractions. طيب غير كده ممكن نستخدم transvaginal ultrasound to measure the cervical length. If the cervix is less than 15 ملم في ال gestational age دي، قبل كان ال gestational age أقل، لكن هنا ال gestational age is 30 or more. طيب ومعانا يعني ال length is 15 ملم or less than the 15 ملم. The determinant to likelihood of birth within 48 hours. يعني هي ممكن تولد لنا within 48 hours. طيب fetal fibronectin screening if the gestational age is 30 weeks or more it will predict labor within 48 hours. طيب يبقى عندنا two methods or two modalities to predict this preterm labor in a lady with contractions. ممكن نستخدم الترانسفاجينال ultrasound، ممكن نستخدم fetal fibronectin. طيب في الأحوال اللي بيكون ما موجود معانا expertise in transvaginal ultrasound or the lady is declining، طيب يعني هي رفضت يعني تستخدم يعملوا إذا إحنا نعمل لها transvaginal ultrasound better we are going to use fetal fibronectin. هنتعامل مع الموضوع ده كيف؟ اللي دي جات وعندها معاها contractions. طيب if the cervical length is more than 15 millimeter it's unlikely that she is in preterm labor. بعد كده we are going to discuss the benefits and risk of going home versus staying in the hospital. طيب if the cervical length is 15 millimeter or less، طيب here we are going to diagnose preterm labor. We are going to offer treatment for preterm labor على طول. طيب if there is no expertise on transvaginal scanning زي ما اتفقنا قبل شوية our lady declines the scan we are going to use the fetal fibronectin if the patient is more than 30 weeks. If fetal fibronectin testing is positive, the concentration more than 50 nanogram per ml, we are going to start preterm labor treatment. If the woman declines both tests, يعني رفضت الاثنين قالت ما بتاخذ الفيتال fibronectin وما بتعمل transvaginal ultrasound, we are going to treat as in preterm labor. When we are going to manage preterm labor, first of all we need to determine is it threatened preterm labor or established preterm labor. We are going to admit if the risk is high. We need to check fetal presentation by ultrasound. After that, we are going to use tocolytics, steroids, and we are going to inform the neonatal units. And we arrange the in utero transfer if no suitable beds available. Steroids. Beta-methadone injection 12 milligram IM, 2 doses 24 hours apart, or dexamethasone injection IM 6 milligram every 12 hours for 48 hours. We use steroids because antenatal steroids will reduce the rate of respiratory distress, interventricular hemorrhage, and neonatal death. Maternal corticosteroids for women who are in suspected or established preterm labor or planned preterm births or have epiprom. طيب إذا كان الgestational age less than the gestational age of viability يعني تكون 23 and 23 plus 6 days هنا بنناقش معاه we are going to discuss with the woman the use of maternal corticosteroids in the context of her individual circumstances لأنه في الgestational age ده بيكون almost يعني miscarriage. But we are going to consider the use between 24 weeks and 35 weeks plus 6 days of pregnancy. We are not going to repeat the course of maternal corticosteroids. لكن في بعض الأحوال we can think about the interval of the since the end of the last course and the gestational age at that time and the likelihood of birth within 48 hours. Tocolytics. The aim of tocolytics is to gain time for the steroids to act on the fetal lung. يعني ما عندنا سبب تاني لاستخدام التوكوليتيك، يعني ما هنستخدم التوكوليتيك نفسها عشان نطول بها البريجنانسي دي 2 weeks 3 weeks 4 weeks like this. يعني أغلب الظن إنه التوكوليتيك اللي إحنا بنستخدمها ممكن تأجل لنا يعني الدليفري دي for 1 week maximum. طيب drug of choice هم اتنين calcium channel blockers in form of nifedipine or oxytocin receptors modulator اسمه الأوتيسيبان. طيب both have minimal side effects profile and have comparable outcome. لكن من ناحية بتاعت availability ومن ناحية بتاعت price وكده النيفيديبين is better than التوسيبان. طيب the others are يعني beta sympathomimetic drugs magnesium sulfate indomethacin and glycerin trinitrites. طيب نيفيديبين for tocolytics ممكن نستخدمه يعني between 24 لين 33 plus 6 weeks of pregnancy لكن in a woman who has intact membranes and are in suspected or diagnosed preterm labor. طيب the initial dose is of 20 milligram followed by 10 to 20 milligram 3 to 4 times daily. Adjusted this doses adjusted according to the uterine activity for up to 48 hours. لكن بصورة عامة total dose ما مفروض تعدي لنا 60 ملغ. طيب which appear to be associated with 3 to 4 fold increase in adverse event. طيب nifedipine and atosipan has a comparable effectiveness in delaying birth for up to 7 days زي ما قلنا قبل شوية. if nifedipine is contraindicated, we are going to use atosipan, and we are not going to use those يعني tocolytics like beta agonist, which has يعني risk and complications like fluid overload, pulmonary edema, myocardial ischemia, hyperglycemia and hypokalemia. طيب الإندوميتاسين عنده maternal side effect like peptic ulcer, GI bleeding, thrombocytopenia, allergic reactions. Fetal complications like early closure of ductus arteriosus, pulmonary hypertension, necrotizing enterocolitis, and interventricular hemorrhage. Magnesium sulfate ممكن يعمل لنا adult respiratory distress syndrome, respiratory depression, and cardiac arrest. عشان كده we are not going to use those يعني tocolytics routinely. If we have a nifedipine or atosipan, better not to use those for tocolytics. طيب. Thing we are not going to use prophylactic tocolytics because they carry a significant risk and should not be used. طيب. ممكن نستخدم المغنيسيوم سلفيت as a neuroprotection، مش نستخدمه as a tocolytic. طيب in the evidence it reduces the risk of cerebral palsy, protects gross motor function in those infants يعني born preterm، وحصلوا إنه عنده فوائد as a neuroprotection. طيب استخدامه like يعني استخدامه during يعني eclampsia and severe preeclampsia. هو in form of 4 gram intravenous bolus طيب over 15 minutes followed by intravenous infusion of 1 gram per hour until birth or for 24 hours. طيب الجستيشن الأجل ممكن يستخدم معاه يعني من 24 weeks ل 33 plus 6. طيب we need to monitor magnesium sulfate toxicity طيب every 4 hours. In the margins of viability 23 ل 26 weeks لازم يكون في liaison with the senior obstetrician and neonatologist. طيب يكون في clear plan للموضوع ده، هو المود of delivery، monitoring الليبر، presence of pediatrician، يعني appropriate intervention at delivery، IV and antibiotic. طيب only if labor confirmed to give IV antibiotic only if labor confirmed. طيب monitoring الليبر نحدده كيف؟ بنحدد يعني مثلا يكون معانا واحد يعني بيبي in the extremes يعني preterm يعني من 23 ل 25 plus 6. طيب هل نستخدم معاه يعني نستخدم معاه يعني continuous CTG or not؟ لأنه اتوجد إنه CTG will not improve the outcome of preterm compared with the intermittent auscultation في those gestational age. طيب الفيتال سكالب إلكترودز، طيب هل ممكن نستخدم الفيتال سكالب إلكترودز في يعني gestational age less than 34 weeks؟ طيب نشوف متى، لكن بصورة عامة we are not going to use this يعني fetal scalp electrode in a gestation age less than 34 weeks. طيب in case of if it's not possible to monitor the fetal heart rate using the external يعني CTG or intermittent auscultation. طيب شيء تاني نحن we discuss this with the senior obstetrician available and we discuss the benefits which likely to outweigh the potential risk, or the alternatives يعني immediate birth, intermittent auscultation and no monitoring have discussed with the woman and acceptable to her. يعني ناقشنا معاها إنه نحن يعني نعمل لها intermittent auscultation ولا نخليه من غير monitoring. طيب ناقشنا مع الكلام ده كله وناقشنا مع سينيور اوبستريشن وحصلنا انه البينيفيت افضل من الريسك، يعني احسن من الريسك وكده، كان outweigh the risk. ممكن هنا في الحالات دي نستخدم the fetal scalp electrode, but in general fetal scalp electrode we are not going to use them in in cases less than 34 weeks. طيب to conduct delivery better دايما تكون in a tertiary care center لأنه بيكون عندنا specialized staff for dealing with يعني such circumstances. But cesarean delivery to obviate trauma from labor and vaginal delivery has not validated. يعني ما هنعمل cesarean section just because this baby is preterm. لأنه cesarean section يعني did not lower the risk of mortality or يعني intracranial hemorrhage في babies less than يعني 1.5 كيلوغرام. الشيء الثاني إنه الإبيزيوتومي may be necessary in absence of relaxed vaginal outlet يعني especially in primary gravidus or primary woman. طيب no use of routine forceps يعني الناس زمان كانت بتستخدم the forceps for the delivery of the preterm. Okay, cesarean section only for preterm breech يعني دايما لو كان معانا preterm breech better to be delivered by cesarean section. Thank you very much.